Hello, I'm Eric Ricchetti, Director of the Shoulder Center in the Department of Orthopedic Surgery at the Cleveland Clinic, and I'd like to present this case of management of unexpected positive culture results after revision shoulder arthroplasty. This is a 47-year-old male who presented 5 years after a right anatomic total shoulder arthroplasty for glenohumeral osteoarthritis. He's had persistent pain and dysfunction since surgery that ultimately led him to retire from the police force. You can see his examination raises concern for rotator cuff weakness and in particular subscapularis deficiency with a positive belly press test. On his x-rays, you can see concern for overstuffing of his humeral component based on this circle fit of the proximal humerus, and on the axillary view on the left, there is signs of anterior subluxation of the humeral component consistent with subscapularis deficiency. His workup for infection preoperatively showed normal serum inflammatory markers and a dry shoulder aspiration, and his preoperative CAT scan confirmed subscapularis deficiency with no signs of component loosening. Based on these findings, we elected to proceed with revision shoulder arthroplasty with the plan to proceed with revision to reverse total shoulder arthroplasty to address both the component malposition and his subscapularis deficiency. At surgery, subscapularis failure was confirmed. There was no intraoperative concern for infection, but his humeral components were well fixed, and his glenoid component showed evidence of significant wear along the inferior aspect of the component. Revision to reverse total shoulder arthroplasty was performed, and the central defect at the prior central peg hole site was addressed with allograft bone graft. You can see his post-operative x-rays here. Post-operatively, all 6 of his intraoperative tissue cultures were positive for C. acnes, and this is a common scenario of unexpected positive culture results with C. acnes in the setting of a presumed aseptic revision. We typically treat these unexpected positive culture results with a protocol of 6 weeks of IV antibiotics, followed by a period of 3 months of oral antibiotics. And the patient did well with this protocol. You can see at 6-month follow-up, good function, and he was able to tolerate his PO antibiotics long-term without any difficulties. The International Consensus Meeting on Musculoskeletal Infection has developed recently for the first time a consensus diagnostic criteria for shoulder periprosthetic and joint infection, particularly to address this common scenario of positive cultures without any other overt signs of infection. They developed a definite infection category, but a summative scoring system to address these other categories of likelihood of infection in which there is less overt signs of infection, including a probable, possible, and unlikely to be PGI category. If we apply the scoring system to the current case, you can see that this patient receives a score of 4 or possible PGI to represent this scenario of unexpected positive culture results in revision shoulder arthroplasty. Thank you.